Here are 10 Puerto Rico Medical Board style clinical vignettes focused on enzyme pathology and laboratory patterns, each with 4 multiple choice options and detailed explanations to help you prepare for board style questions. Vignette 1: Liver Injury Pattern. A 45-year-old alcoholic man presents with fatigue and jaundice. Labs: AST 320UL, ALT 110UL. What is the most likely pattern of liver injury? A. Viral hepatitis B, alcoholic hepatitis C, cholestasis, D. Hemochromatosis. Answer B. Alcoholic hepatitis. Explanation: ALT, often in a 2:1 ratio, suggests alcoholic liver disease due to mitochondrial injury. Vignette 2: Pancreatitis. A patient with epigastric pain radiating to the back has elevated amylase and lipase, which is more specific for pancreatitis. A. AST, B. Amylase, D. Lipase. Explanation: Lipase is more specific than amylase for diagnosing acute pancreatitis. Vignette 3: Muscle injury. A marathon runner has sore muscles and dark urine after a race. CK is elevated. Which isoenzyme is most specific for skeletal muscle? A. CKMB, B. CKBB, C. CKLD. Explanation: CKMM is the major isoenzyme found in skeletal muscle and increases with rhabdomyolysis. Vignette 4: Myocardial infarction. Which lab marker remains elevated the longest after myocardial infarction? A. CKMB, B. Myoglobin, C. Troponin 1, D. LDH. Answer C. Explanation: Troponin 1 stays elevated for 7 to 10 days, useful for late detection of MI. Vignette 5: Cholestasis. A woman with pruritus, jaundice, and fatigue has elevated alkaline phosphatase, ALP, and GGT. What is the likely diagnosis? A. Hemolysis, B. Biliary obstruction, C. Viral hepatitis D, muscle injury. Answer B. Biliary obstruction. Elevated ALP plus GGT suggests cholestatic liver disease or bile duct obstruction. Vignette 6: Bone versus liver ALP. A patient has elevated ALP. To determine if it's from liver versus bone, what test helps? ALT, B, CK, C, GGD, LDH. Explanation: GGT is elevated in liver disease but not in bone disease, helping differentiate the source of ALP. Vignette 7: Hemolysis. Which lab finding is consistent with hemolysis? A. Elevated haptoglobin, B. Increased AST, C. Low LDH, D. Decreased unconjugated bilirubin. Answer B. Increased. Explanation: Hemolysis causes elevated LDH, AST, and indirect bilirubin. Haptoglobin is decreased. Vignette 8: Paget's disease of bone. An elderly man with hearing loss and bone pain has elevated ALP. Calcium and phosphate are normal. Diagnosis: A. Hyperparathyroidism, B. Osteoporosis, C. Paget's disease of bone, D. Rickets. Answer C. Paget's disease of bone. Explanation: Isolated elevated ALP with normal calcium phosphate suggests increased bone turnover. Vignette 9: Gilbert syndrome. A young man has mild jaundice during fasting or stress. Labs show elevated unconjugated bilirubin with normal LFTs. Diagnosis: A. Crigler-Najjar syndrome, B. Gilbert syndrome, C. Dubin-Johnson syndrome, D. Hemochromatosis. B. Gilbert syndrome. Explanation: Gilbert is a benign condition due to reduced UDP glucuronosyl transferase activity, leading to mild indirect hyperbilirubinemia. Vignette 10: Inborn error. Maple syrup urine disease. An infant presents with poor feeding, lethargy, and sweet-smelling urine. Lab shows increased branched-chain amino acids. What enzyme complex is deficient? A. Alpha-ketoglutarate dehydrogenase, B. Branched-chain A-keto acid dehydrogenase, C. Phenylalanine hydroxylase D, pyruvate dehydrogenase. Answer: Branched-chain A-keto acid dehydrogenase. Explanation: MSUD results from defective breakdown of leucine, isoleucine, and valine.